Hey Dee, I hope everything's going well today. I saw your last message. All right. Today I'm going to be talking about more gut stuff, which is one of my specialties. I'm going to be talking about trauma, IBS, and digestive issues. Let's see here. Okay. So I'm going to get started. I'm 3 minutes after 6:30. So if you didn't sign up for the Zoom, let me know, and I'm trying to record it, so maybe you can look at the recording if you didn't sign up for the Zoom. I'm thinking to even stop doing the lives on Instagram and just I probably will go to just doing the Zoom or emailing the Zoom out to folks, so that way people can look at it when they get a chance to. But this month we're focusing on irritable bowel and on SIBO, which is small intestinal bacterial overgrowth. And I see a lot of this in my practice, and there are many reasons why people have this going on, but we're going to focus today on the symptoms, and we'll start talking about the causes. And then the next couple of days, I'm going to get more into the gut-brain connection, and I'm going to talk about what people can do and how they can work with me. So, all right. So in my practice, I use a diagram it's on my website. And that diagram shows that the mental, emotional, spiritual is at the center of like the health paradigm. And if you don't work on that, then the rest of the health is just not going to get into line. So it's super important to pay attention to that. And I call it the practice paradigm, and it comes from the functional medicine pyramid. And in that paradigm, the center part is pink, and then the surrounding mental, emotional, spiritual is a light blue color. So you may have heard the term, or maybe not. Doctors speak to each other in this language, and they call IBS a functional digestive issue. And what that means is that it's considered functional, and they use this term for other things like functional brain disorder, functional this, functional that. And what it means is that the test didn't show anything, like they'll do a colonoscopy, they'll do some blood tests, and they're only going to do like some traditional blood tests in conventional medicine. And if those things don't show anything, they call it functional. And like 20 years ago, when they used to talk about they used to call fibromyalgia functional muscle disorder, and that was kind of code word for it's in the person's head. But we know now that that's not true. These disorders, there's really something going on. We're just not, in conventional medicine, they're not doing the right tests to see what's going on. But in functional medicine, which is what I do, it's a type of integrative medicine. We do different tests, and we're able to see what's going on. One of those tests is like a stool test, which you may have heard of. So commonly, people will have pain when they have irritable bowel, and the pain in the belly is very common, and people have gassiness and bloating, and that's very common, and it's usually associated with constipation or diarrhea, or they go back and forth with both. And you probably heard me talk about leaky gut before. Leaky gut's kind of a precursor, or it can be going on when people have SIBO, and if they have irritable bowel, which we call IBS. And leaky gut is a situation where in the gut you have these villi that are part of the intestines. So the food is going here, and then you have these finger-like projections that are microscopic. They're not big like my fingers. So in the gut, what happens, you have mucus that's overlying all these finger-like projections. And these finger-like projections are what are really doing the absorption of the nutrients. And the mucus layer, when you have the right mix of bacteria in there, it's containing things like enzymes and things that are helpful to the digestion. But if you have a lot of pathogens, then it may be starting to tear down these villi, or it may make the mucus so thick that the nutrients can't get through. So typically what happens though is that people are eating inflammatory foods, and those inflammatory foods like gluten, dairy, for some people will just chop off the villi, and then you just have the raw like mucosa there, and it may have mucus, it may not have mucus, but definitely you're going to have a malabsorption situation where you're not able to absorb the nutrients, and there's a lot of inflammation going on. And unfortunately, in these spaces in here where you have tight junctions, things, pathogens or bad bugs, whole molecules of food can just get directly into the bloodstream, and that causes inflammation. So it's not a good situation. All right. So what's SIBO? And I mentioned that in the beginning. It's small intestinal bacterial overgrowth. And it's a chronic, it causes a chronic inflammatory condition, and it causes infection inside the digestive system. And we have hundreds of millions of microbes in our gut. And if we spread out our intestines, we could cover a whole tennis court. So it's a lot of square footage that our digestive system covers. And 2/3 of our immune system is in our digestive system. So when things aren't going right in the digestive system, that is why the immune system will not be working right. And when you have 2/3 of the immune system in the gut, which they more recently discovered that this was going on, that means that your immune system is going to be like in a state of confusion, not working properly. And that's where you get autoimmune diseases. It originates in the gut. They still are not admitting that in conventional medicine. They are recognizing it for certain autoimmune diseases and not for others, but we know in what we do that it's the root cause of all the autoimmune diseases. We already have the studies that show this, lots of studies that show this. So don't expect your doctor to understand what SIBO is. They barely know what irritable bowel syndrome is. There's also another term called IMO, which is EMO, which is in the large intestine, and it's a similar condition of chronic inflammation. Hi, I guess that's Dawn, MG Holistic. Great to see you. Okay, so, and then we have yeast overgrowth. Now, yeast overgrowth is very common, and we see it a lot with diabetes and insulin resistance and people with sleep apnea. What that means is that you have too many yeast growing in the gut. This is very, very common because most people that I see when they're having problems, it's because yeast is one of the first ones that set up in the gut. If you have sugar cravings, or if you're craving a lot of processed carbohydrates, it may be that you have yeast, and it takes a focus to get it down. Like say, for instance, if you go to your primary care doctor, they might give you, first of all, half of them don't believe in this, and then they may only treat you partially, like they may only treat you for 1 or 2 weeks. But this needs to be treated for several months, and it needs to have layers of treatment. So just taking like a diflucan for a couple of weeks is not going to get rid of it. So a lot of people have IBS because they have yeast overgrowing. And if you've had antibiotics, it's easy for yeast to take over. That's another thing that can cause yeast to take over. So SIBO is a chronic infection that's low level, and there are other issues like chronic viral infections like COVID and Epstein-Barr and CMV And also Lyme disease and its co-infections can cause a SIBO to set up. And once you get a SIBO, it can be hard to get rid of. You have to sign up to work with someone who knows how to deal with SIBO and has experience. Hi, Shiva Shima. It's great to see you here. All right, so the next thing that can contribute to these gut situations is food intolerance, allergies, and sensitivities. And you may have heard me talking about food allergies, sensitivities, and intolerance. I talk about gluten a lot. I talk about dairy a lot. Corn is one that's high on the list. And soy is one that's high on the list, and that's because they're genetically modified in general. Okay, so another level is toxicities, nutrient deficiencies, and negative emotions. And we're going to talk more about the negative emotions. But toxicities, think of things like heavy metals, other toxins like pesticides, like glyphosate, can cause you to have chronic gut issues. Okay. Negative emotions. So how many of you, have you ever heard of the ACE study, the Adverse Childhood Experiences study that the CDC and Kaiser partnered up to do? They actually have, if you go on the CDC website and look up ACE, ACE, you can find some of the information there. Or if you just go on Google and look up ACE study, you'll see there's a questionnaire. They actually had a 60-minute special that Oprah, I believe Oprah did the interview, and she interviewed the scientists that had to do with the study. This was a few years back. And what they found was that there are some common background issues in people's childhood that may lead to health problems later in life. So things like child abuse, and that doesn't have to just be physical abuse. It could be mental abuse, molestation, sexual abuse. If the child had a neglect situation, if they weren't fed properly or cared for as a child, there's a whole list of things, and you can look, you can look on the CDC website, like I said, or you can look it up on Google. So it's also emotional abuse. If the mother was treated violently, even if the child was in the womb, the child can experience like a form of PTSD from that. If the child was within a divorce, if there was substance abuse, if they had an incarcerated relative, or if they grew up in a household with dysfunction because of mental illness. These are all things that can contribute to adverse childhood experiences. And we just, in mental health, we lump that all together and call it adverse childhood experiences. And we know what's going to result from that. Okay. And one of the top things, like they have a pyramid that you can see that's on the CDC website. And death is one of the ultimate results that can happen from adverse childhood experiences. And it's premature death. So what happens is they can have different physical disruptions in their health because of the adverse childhood experiences, disease, disability, social problems, and then the ultimate thing is death. And usually it's premature death. If people don't get their mental health addressed, it can lead to premature death. That's the extreme. So, and they found also that early adversity that children experience can result in many issues in health with adulthood. And it's found that the earlier that people get intervention or mental health intervention, that they can actually have a normal lifespan, normal occurrence of diseases can be reduced, and they can look more normal the earlier they get treatment. And it's never too late to get treatment for adverse childhood experiences. I mean, I worked in the VA and I saw a lot of veterans that had this layering of they had the adverse childhood experiences, and then they went into the military trying to get away from their childhood household. But then because of their mental state and their mindset, they were attracted to the military, went to war, and then got PTSD in the war. So you have layering of PTSD, which causes complex PTSD. And pretty much all the time, there is some gut issue that's involved with the PTSD or with the adverse childhood experience. And it just goes on and on. So, all right. So that is going to be the end of my discussion today. I'm sorry I went a few minutes over, but I guess I started a few minutes late. Do any of you have any questions about what I talked about today? Tomorrow, I'm going to be talking about some of the studies that show the correlation with the gut-brain connection and with what's happening with irritable bowel and with SIBO and EMO. Thank you so much. Thanks for coming on. Thank you. Thank you so much. So, all right. Thank you. Thank you so much. Thank you so much. Thank you for joining me today. And I'll be back here tomorrow at 6:30. Thanks for joining. Bye-bye. Have a good night.